On the coronavirus epidemic, the case counts are continuing to decrease. Since this time yesterday, we've identified 109 new cases in Philadelphia residents, bringing us to a total of 30,986 since the beginning of the epidemic. Now, we received the results of more than 3,000 tests since yesterday, and that 109 represents 3.6% of those tests being positive. That 3.6% is lower than the percent positivity we've seen in the past. That's a good sign. In the past 2 days, we've been at just over 100 cases per day. That's lower than the 124 cases per day that we now have for the average for last week. So that also is a good sign. And another good sign, we've had 0 new deaths identified from coronavirus in the past couple of days. Our total for deaths since the beginning of the epidemic is 1,695. That's what's happening in the city. Outside of Philadelphia, we're also seeing declines in the number of cases every day. We're seeing declines in the counties around the city of Philadelphia. We're seeing declines in the state of Pennsylvania as a whole, and we're seeing declines in the country as a whole. According to the database that the New York Times presents, in the past 2 weeks, case counts in the US as a whole have fallen 14% in the past 2 weeks. So in summary, our case counts are falling in the city, in the region, and the nation as a whole. That's really good news. I can only say now that I hope it continues. Now let me talk a little bit about contact tracing. As case counts go down, contact tracing becomes even more important. Just to remind people, is the process for notifying people that they've been exposed so that they don't in turn pass the infection on to others, so that we stop the chain of spread of the virus. Now, this involves our staff calling people and providing them information and asking for information. Our biggest obstacle to the success of contact tracing right now is people who don't answer the phone calls from our staff or people who don't provide information on contacts. Now, most people in Philadelphia do, but about a third of people don't. So I want to ask people in Philadelphia to do 2 things to help us contain this virus. First is to simply answer the phone when the health department calls. The second is to help us protect others by providing the information that we ask for. Let me talk about each of those in turn. First, about answering the phone. You know, we all hate getting robocalls, and all of us don't answer the phone if we don't recognize who the caller is. But this is one call that you should pick up. Our contact tracing staff almost always call from a number that starts 215-218, then 4 more digits. 215-218, 4 more digits. That's our contact tracing staff. If you don't pick up the phone, they'll leave a message with a direct line you can call to return to speak to the person who left the message with you. If you want to verify that this is the right person, anybody can call our public health call center to ensure that it's real. That's 215-685-5488. 215-685-5488. If you're wondering whether a call is actually from the health department or not. Now, people who have the infection need to provide information to us on their contacts, the people that they may have exposed. They may have exposed others who don't know it, and they deserve to have that information, both for their own sake and for the sake of their family members. So our staff will notify the contacts for you. Even if you have the infection, even if you've already talked to the people you think you've exposed, we still need to speak to those contacts. We can provide them with detailed, accurate information that will help them and will protect others. And this process is entirely confidential. We never give out the names of cases or contacts to anyone, not to law enforcement, not to other people, and we don't give the names out of contacts of cases to the contacts. We simply tell contacts that they've been exposed to the virus and that they need to go into quarantine so they don't pass the virus on to others. So if you have the infection and you get a call from the health department, let them know who you've been around so that you can help contain the spread of this infection. That's all for today. If you want more information, go to our website, www.phila.gov/COVID. Thanks.
I had a question, I guess, about different topics, but I'll try to ask this about in relation to COVID with the encampments at the Parkway. Are there concerns regarding the COVID spread there, and are there plans on moving forward with what's going to happen at that encampment as far as what the next step is?
Doc, you want to talk about the COVID first?
So, you know, we're concerned whenever people are around each other about the likelihood of spread. People outside probably have a lower risk than people inside, but certainly if people are near each other outside, not wearing masks, there's some risk of spread.
SEPTA says they're able to fully ventilate, these are for Dr. Farley, by the way, fully ventilate subway cars, regional rail cars, buses every 2 to 3 minutes. I'm wondering if you can just contextualize that metric, how safe that sounds to you compared to other indoor spaces.
I didn't hear the exact metric, but it sounds like that's a lot of air exchanges per hour, and as much as we would recommend. That does not is not a replacement for people wearing masks and keeping a distance, and that's important. And there's some people, some businesses, for example, that say that they have a great HVAC system and therefore they don't need to have people wear masks. That's not true. People still need to wear masks and keep a distance. And ventilation may be a valuable adjunct to that.
Okay. Can you tell me, just in your opinion, the relative safety of riding public transit right now in general? And are you concerned about it getting a little riskier when bigger crowds start to return?
We do have some concerns about that. I think it's really unknown how much risk there's going to be in public transit. There's a lot of theory you can put out there, but until you actually have experience with it, you can't say for sure the likelihood of spread. I can say that if our case counts are going down and people wearing masks, we're going to have lower risk in the future than we do now. And I'm hoping that that's the case, that if the ridership increases, it's increasing at a time when we have much lower rates and people are much more compliant with wearing their masks.
Question is for Dr. Farley. Dr. Farley, what is your reaction to Governor Wolf announcing today that all high school sports should not be played until January 1st?
I think it's a wise move. There's a risk that in contact sports in particular, that children are going to be in close contact with each other, spreading the virus. If you have different teams coming from different communities, there's more mixing, more opportunities for spread. So it's a risk that I don't think is worthwhile taking right now.
And do you feel the same way for college sports as well?
I'm definitely concerned about college sports. Our current posture in the city is that we don't prohibit those competitive sports, but we strongly recommend against it. We recommend that those teams do skill building only and not do competitions.
I know you had said on Tuesday that you weren't sure why cases are decreasing. Have you been able to shed any more light on that? Why the sudden or unexpected drop off in cases?
I can't say for sure. Looking back on it, it looks like the entire area may have peaked as far as cases in around the middle of July. Sometimes you can only see that in retrospect. And that's somewhat consistent with the peak that the country had around that time. So this may be related to the fact that, to a certain extent, this epidemic is a national epidemic and we rise and fall with the nation. I do think that the fact that Philadelphians are wearing masks a good percentage of the time is helping. And our education about other social distancing measures is helping. That doesn't fully explain that, but I'm hopeful in view of that, and in view of the fact that rates are going down across the country and across the region. I'm hopeful that this decline will continue.
Okay, and you've mentioned that a lot of these recent cases have been in younger people. If there was going to be a spike of them having spread it to older relatives or other older people, do you think that already would have happened, or could we still sort of see a wave as some of these younger people had spread it?
I think it's still possible that there would be a delay and when we might start to see the cases in older people later on. We're watching that closely. We are getting some cases in people over the age of 70, but not large numbers right now. And I can say we hope to keep it that way.
Okay, and one last question. Today marks 5 months since Pennsylvania announced its first cases, and Philly was just a couple days after that. Looking back at 5 months ago, where we are today, do you think it's better or worse than where you might have expected to be?
Well, we're far better now than we were back in March and April. Again, we were having almost 250 deaths a week back at the peak of this, and now we're one death a day, approximately 7 deaths a week. I don't think I could have predicted at that time where we were going to be in August. I'm glad that things are as low as they are. I want them to be lower still. I'm concerned what's going to happen when the weather turns cold and respiratory viruses tend to get worse. So we're not out of the woods, even if case counts start to continue to fall over the next few weeks. But I try not to predict, and I don't think I could have predicted back then. I'm just glad at the moment that case rates are falling.
Okay, thank you.
Thank you, Laura, and thank you, Dr. Farley, and all our participants today. We are out of time, and if there are further questions, including on the Digital Access Initiative, please forward to press@phila.gov. Thank you.